Tri-County Planning Body meeting. What time is it? 4:02, starting. This is an early start, I believe, for us. So why don't we dive right in? We have a really robust agenda today, a lot to move through, and really want to just get us started. So let's start with some introductions. I'm gonna call on folks on the screen first, if we could, and then we'll bring it into the room. Matt, you're the first one in my view. Jump in.
Hi, Matt Chapman, he, his, retired software and et cetera type, and co-chair of the TCPB.
Thank you, Co-Chair Matt Chapman. Yvette.
Hi, everyone. I'm Yvette Hernandez. I'm a community member, and my pronouns are she and her.
Great, thank you. Steve.
Hi, everybody. Steve Rudman, he, him, community member.
Thank you. Christina Palacios.
Hi, everyone. Christina Palacios, she, her pronouns. I'm with Housing Oregon.
Thank you. Welcome. Councilor Lewis.
Hi, Christine Lewis, pronouns like she and her. Good to see you all.
And Nova.
And then looks like Cristina Castaño. Want to say hi?
Everyone, Cristina Castaño, she, her pronouns, with the Joint Office of Homeless Services.
Thank you. Zoe popped on. Hello, Zoe.
Hi, sorry I'm late. Soy La Copiano, Community Action, Washington County, she, her, ella.
And then I see Abby out there. You're not in the room too, right, Abby? Nope, there you are.
I'm not. Abby, her, and she, her, Metro Housing Policy Analyst.
Okay, let's bring it to the table. Monta.
Monta Knutson, Bridges the Change. My pronouns are he, him.
Thank you. Brianna.
Just in time. Brianna Flores, she, they pronouns, and I'm with the Joint Office.
Thank you. Mindy.
Hi, Mindy Statlander. I use she, her pronouns. I'm with HealthShare.
Great, thank you. And good use of the mics, everybody. You're already pressing the button the right way. Appreciate that, Mike.
Mike Liu, Fubon Shopping Center and community member.
Thank you. Nicole.
Nicole Larson, she, her. I'm a licensed clinical social worker and city liaison for Imago Dei community.
This is Colin. We're kicking him out, but he's filling in for Ariella today, so he'll be doing our meeting summary. Colin Baker with Kearns and West. Your facilitator, Ben Duncan. Good to see folks. Ebony.
Ebony Brown, she, her pronouns. I'm the co-chair of this board along with Matt and also, where do I work?
Chris, you got more to say? You got more? Chris, you can say hi now, and I know there'll be a little more.
Chris Pence, I'm with Metro. I use he, him pronouns.
Thank you. Valeria?
Good afternoon, everyone. Valeria McWilliams. I use she, her pronouns. I'm the Regional Alignment Supervisor here at Metro.
Mercedes?
Hello, everybody. Mercedes Elizalde, she and her pronouns. I'm the Director of Advocacy at Latino Network.
Thank you. Nicole?
Hey, folks. Nicole Sting, she, her pronouns with Washington County.
Thank you. Chair Vega Peterson?
Good evening, everyone. I'm Jessica Vega Peterson. I use she, her pronouns. I'm the Multnomah County Chair.
Thank you. Chair Harrington?
Look at that, I turned it off.
Recording in progress.
Oh, yeah, see? Right
Catherine
time.
Harrington, elected chair of the Washington County Board of Commissioners, she, her pronouns.
Thank you. Jess?
Afternoon, Jess Larson, Washington County Assistant Director of the Department of Housing Services.
Yep, Adam.
Hey everyone, Adam Brown, he, him pronouns, Deputy Director of Clackamas County's Health, Housing, and Human Services.
Let's make our way to our esteemed colleagues in the back. Malia?
Malia Dieter, she, her pronouns, Metro.
Giovanni?
Giovanni Bautista, he, him pronouns, Metro.
Let's come back around. Patricia?
Patricia Rojas, she, her pronouns, Housing Director, Metro.
And last but certainly not least.
That's very kind, Ben. Liam Frost, he, him, his pronouns, Deputy Director of Housing here at Metro.
Okay, and I know we have some other folks. Cole, do you want to yell from the back or come up to a mic real quick?
Hey y'all, Cole Merkel, he, him, his pronouns. I'm with Metro. I'm just here observing today.
And Ruth?
Hi everybody, Ruth Adkins, she, her pronouns, Housing Policy Advisor, Metro.
I did see Israel lurking in the back over there, so well, but folks have met him. So did I miss anybody? Did anybody join online since we did intros? And we got everybody in the room, great. So I'm gonna walk through some of our logistics as we do at every meeting, and then we'll move through our agenda. So as a reminder, for our safety plan, we're on the 3rd floor. Is the front fixed?
Not yet.
Okay, so in the event of any emergency, there's exits in the corner, as well as the stairs that I imagine folks came in, or the elevators, not elevators, huh? No fire. Yes, thank you, Matt. In the event of emergency, there's also a defibrillator in the back corner of the room. And if we end up having to vacate the building, then we're meeting along the MLK street side, correct?
Correct.
Okay. Any questions about safety plan? Okay. So just a couple meeting practices. So everyone did some good modeling as we started today. Remember that the mic's on and off. So if you're not speaking, you can turn your mics off. But if you are gonna add input, please press the button. It should be red, though it's hard to see. But just make sure your mics are live so folks are able to hear you. We're going to encourage that, folks, and I see most of our members, if not all of our members, are on screen now, so encourage cameras on. And a reminder for those that are joining online to change your chat to everyone instead of host and panelists. All of what we share in this body is public record, and we want to make sure that the public can see what we're saying. If you do have any technical issues during the meeting, you can feel free to reach out to Metro staff directly, and they can help you navigate any concerns that you're having. So before we move into our review of the agenda, Valeria, I'd love to pass it to you.
Thank you, Ben. I just wanted to reintroduce Chris and Ruth. We are so excited that they have joined the regional alignment team here at Metro, and I'm happy to share some of the bodies of work that they will be leading. Chris will be leading the landlord recruitment and retention goal, and Ruth will be co-leading the healthcare systems alignment work along with the employee retention and recruitment work. So very happy to have them here again. So feel free to reach out to them if you have any questions on those bodies of work. Thanks.
Great, exciting, thank you. And Yesenia, can you introduce yourself and then provide some updates?
Yeah, hello everyone. My name is Yesenia Delgado. I use she and her pronouns, and I'm the SHS manager here at Metro. Is this a good time to provide the oversight committee updates?
Yes, please.
Great. Well, again, thank you all for having me here today. As a follow-up to the SHS audit that was conducted earlier this year, we agreed with the auditor that more ongoing communication threads between both of the committees of the TCPB and the SHS Oversight Committee would be important. So as you all have seen in your packets, we started implementing and sharing the meeting minutes between the Oversight Committee and the TCPB in each other's meeting packets. So that way you all, as you're reviewing those meeting packets, get to see what the other committee is working on. And as part of that work, we are also going to start providing verbal updates. So coming to each other's committees on a quarterly basis to just provide an overview of the work that has happened in that quarter on each other's committees, and then also provide a brief update of the work that's coming. So I'm here today to provide a quick overview of the work that the Oversight Committee for SHS has been working on. Really during this past quarter, they have been really busy working on the regional annual report process. So that has consisted of getting all 3 counties' annual reports, reviewing them for and conducting a review of performance, highlights, challenges, and opportunities, having discussions and connecting with the counties and answering questions that they might have. And that all of that gets rolled into the Oversight Committee regional report. Now, this regional report doesn't have any new data because it's using the previous data for each of the counties. But what it does provide is, again, the Oversight Committee's opportunity to be able to talk through performance. How did the county do? What opportunities came up at a regional level? And it also drafts recommendations for a Metro Council to review on further implementation and opportunities for improvement for SHS. So that is what the Oversight Committee has been working on. And just last month, at the end of April, they finalized the regional report process. So that is final, and I'm happy to share that out with folks. And they've also drafted the recommendations. So there's 11 different recommendations, and the different recommendations are from anything from, enhancing our communication strategy to enhancing the data work that we're doing, advancing further the reporting templates so that we have a better understanding of the work that's happening, and also doing some work on the program side of things. So there's some recommendations there around the work that we're doing with outreach and behavioral health. So kind of what's next is the Oversight Committee co-chairs and staff will be calling a Metro Council actually this upcoming Tuesday to provide an overview of the regional report process, the recommendations, and answer any questions that council might have. And then over the month of April into really the first week of May, co-chairs and staff and other members of the Oversight Committee will be attending the different Board of Commissioners at each of the counties, Washington, Multnomah, and Clackamas, to again do an overview of the regional report process and the recommendations that were approved from council. So that's a little bit more about the work that's happening at this month's Oversight Committee. We have all 3 counties coming in to provide a quarter 2 update for SHS. So they'll be presenting on their outcomes, but also doing a deeper dive into their other qualitative goals in their work plan, along with answering any questions that the Oversight Committee might have. So that's all I had today in terms of an update. Valeria, Ben, I'm not sure if there's time for questions, but happy to answer if there are any.
Think any burning questions? Any questions for Yesenia on the update? Okay, and hopefully the resources provided are helpful for folks tracking the kind of multiple processes unfolding. So before we review the agenda, I'm going to ask our co-chairs to move us through the meeting summary for February's for approval.
So moved.
Second.
Thank you. So motion by Matt, seconded by Ebony. All those in favor of approval of the February meeting summary, say aye or raise your hand. Any opposed? Okay, approval of the meeting summary. So I'll be brief in reflecting our agenda because we do have a lot to move through. So we have kind of 2 large topics. The first being an update on HMIS, really closing the loop on previous work that you've heard and presentations that have come up before. Chair Harrington, is that a question or is that a? Okay. And really an opportunity for you all to continue to gain more clarity on kind of what the work looks like, the structures, and how it fits into the broader goals across the body of work. And then the second piece is continuing our work to advance landlord recruitment and retention. And you've been provided with an implementation plan from feedback that you all have given, work that the Metro and the counties have done, is provided in your packet. And hopefully folks had a chance to review the email that came out and really an introduction of a process that we're hoping to use not just for today, but as we move implementation forward over the life of our work. And so the hope is we'll replicate this process over and over. So you'll hear a high-level presentation on what's been provided. We're going to ask, in the spirit of hearing from everyone in the room, to do a round robin. And as you do that, I'll ask you, and I'll give these directions again. We're really going to use a process where thumbs up means I'm good to go. Thumb sideways means I have some concerns, but they're not going to get in the way of approval, but I need to articulate considerations that I want to put into the room. A thumbs down means I am not willing to move forward. And if you are a thumbs down, I'm going to ask that you come with an alternative or a proposal that will help get you to yes. Right? So that is the ask. We're going to go around the room. Everyone will have an opportunity to offer their insights and reflections, and then we will vote. I will remind folks that for the purposes of approval, it will be a majority vote, but just do want to make sure that we have done our due diligence to ensure that we've heard from every voice in the room. So we'll come back to that, but I just want to preview that process. My hope is that it provides everyone an opportunity to really bring their voice into the space, articulate any concerns, or articulate any supports, and expressions of support for the work moving forward. So I'm going to leave it there. Chair Harrington?
That process sounds great. Thank you. My question is this. By the end of the day, Friday, I had 8 packets I needed to read for this week, and that includes the TCPB packet. So I did my best. And then at 4:46 last night, we received an update to this packet with a few useful things, but I'm scratching my head. Meeting packet with slight updates. But that's it. I have no idea where in the packet the updates existed. So I just want to let you know that I'm not on the journey with the updated packet. So I'm going to need a little help in this meeting.
So can we clarify, because
Yes, I'm sorry, I apologize for that. We'll provide specific details on what those updates are. The update was mostly in the monthly progress report. That was really the only update. Under the training and technical assistance section, we had an issue where we had combined last month's and this month's update together. And so it was just removing last month's. Yeah, I'm very sorry for that oversight.
No, but that's a great call, Chair. And so Valeria, I appreciate it. We'll just name it for the record that in the future, any updates to packet will be directed. So you're not scrambling to find where's Waldo, I guess, is maybe one way to think about it. Any other questions or comments, concerns about what we're doing today? Okay. I believe we have some space for public comment, so this is a chance in our agenda for anyone who's in our audience who would like to offer public comment today, to be able to provide input to this group. It's not a chance or a space for deliberation, but an opportunity to provide insight, input, and thoughts for the Tri-County Planning Body. So I'm going to ask if I don't see anybody in the room for public comment. If you are in the audience and would like to offer public comment, we'll ask that you raise your hand. I'm not seeing anybody on the phone. So for our attendees in the audience, if you raise your hand, we'll promote you to a panelist and you'll be given 3 minutes to speak. Welcome, Sahan. So last call for public comment for Tri-County Planning Body. Not seeing any hands raised. We'll conclude the public comment period, but I do want to welcome Sahan. Can you introduce yourself, my friend? I guess, reluctantly, I'll take it.
Good afternoon, everybody. Sahan McKelvey, happy to be here with all of you. Anything else I need to say?
I mean, whatever's on your mind, I don't know. I'm just kidding.
Whatever's on my mind. Great to be here.
We'll leave it at who you are for the moment. Thank you, Sahan. Welcome. So, Dan, can we bring you up? So we're going to move into our first agenda item on HMIS, the strategic sourcing update. Patricia, I think you're going to kick us off.
Sure, I'll introduce the agenda item. So as you remember, in September, this committee received a presentation from Multnomah County about a strategic analysis on homeless services technology. And that analysis was being conducted as a part of the process of moving the HMIS system. So HMIS is Homeless Management Information System, and it is an umbrella term for any variety of technologies used to track homeless services data. And so the system that was historically held in the city of Portland was migrating and is, I think, still migrating to Multnomah County. And an analysis was done as part of that process to understand needs, how the technology is serving the work that we're doing. At the time, you all were very interested, asked to be a part of the process, and asked them to come back. So that actually happened, and so we're closing the loop. Multnomah County is coming back to share the results of that study. And so today really is just informational and closing that loop. So with that, I'll pass it to Daniel Cole.
Okay, on now? So I'm Dan Cole, and I'm a portfolio manager in IT at Multnomah County. Thank you very much for letting me come back and the Gartner team come back. Yes, we did the presentation in last September about this work. So I want to give you kind of a little bit of an overview of why we're here, why we're sort of informing you about it, and why this work is important, I think, to pay attention to. So Multnomah County IT is taking on responsibility for the HMIS for the 3 counties. And DCA, our Department of County Assets, is sort of a centralized group, so IT is sort of centralized. My role is to support the joint office in any of their technology needs. And with regards to my team will be supporting the underlying sort of technology infrastructure, and then each county sort of administers it themselves in terms of how they operate it. But as we started on this journey, one of the things that we noticed was that there was a lot of concerns regarding data. You probably heard a lot of concerns regarding data. There's a lot of concerns regarding the technology. And then there's also just new initiatives and new things that want to be done. And then we run into the barriers of trying to actually implement those. And so in our due diligence of sort of taking this responsibility on, we started engaging Gartner to do a strategic technology analysis and assessment. And so what does that really mean is that we wanted to know how well the system is working. Is it meeting our needs? We wanted to identify a common vision. We wanted to know what capabilities that we need, that the technology needs to meet and to meet the vision. And then we wanted to do a market scan to see how well the current product landscape matches up with what we want. It's relevant, I think, for you all because the HMIS technology supports the entire homeless response system. This technology is underlying all of the work that gets done. All of the data on the programs, the workflows, systems of care. So if you think about the behavioral health system, anytime you try to tie data together with these other systems, you need these things to work. It also contains all of the information regardless of funding source. So whether it's from HUD, whether it's from SHS, whether it's from local, state, at what level, it all gets captured. All of the data is captured in that singular system and database. And I think without a holistic strategy and vision about where we're going with the technology, we'll be limited in what's possible. So as we start thinking about whether it's engagement, outreach, trying to do any sort of GPS location searching, trying to do mapping, any of that kind of stuff is limited by the product that we use and the tools that we use. So we brought in the Gartner team to talk, to look at this situation and to help us because they have some key expertise in this area and can help us do this work. And we're going to talk, Min here will talk about the process, what was done there and the results of that work. I want to thank Gartner for the excellent work that they did and also coalescing a ton of different voices into a singular vision. There was a lot of people who were involved in that, and so they did a great job there. And so I'll introduce the team that led this work at Multnomah County. The project manager for IT was Megan McHenry, and then from Gartner, we had Chris Reagan, who was the senior managing partner for state and local government, Min Chong, who will do the presentation as associate director for state and local government, and then David Lynch was a consultant for the Gartner consultant. And I'll turn it over to Min. I think we'll just end up probably saving questions till the end so she can get through the presentation, and then we can sort of do deep dive from there when we get to the end there. But hopefully Min can jump on. I don't know how well that works, but
Yep. Can everyone hear me?
yeah, we can hear you.
All right, awesome. Thank you. I'm actually recognizing a number of names and faces of who's in the room from some of our discovery efforts throughout this project. So thank you all for your participation then and your engagement now. So the slide that you see right now is essentially, I think Patricia and Dan did a great job kind of giving the context of why we were asked to do this analysis and some of the major components of it. So I'll go ahead and skip this slide, but can answer questions as we go. All right, so what you see here is overall the approach that we took to the project scope that was presented to us. And what we want to call out here, as Dan was mentioning, is that we did talk to as many stakeholder groups as we could. So the findings from this report come from providers, participants, program staff, system administrators, IT county and regional leadership, from all three of the counties that are relevant for this analysis. So we did involve everybody in the project. All right, and I'm just going to mention that for each of these deliverables, what you're hearing today is purely the executive summary of the project. But for each of the steps, you'll see kind of referenced here, the current state summary, business capability model, market scan, et cetera. There are full reports with additional detail for each of those. So if there's additional information that you're looking for beyond what we present today, there are reports to support that as well. All right, so if we can go to the next screen. So the first thing that we wanted to do was really understand what are people looking for out of the HMIS today. Originally, the HMIS was a system that existed for primarily compliance reasons as a HUD reporting software, but obviously the needs have changed, the landscape has changed, the service delivery models have changed, et cetera. So has the vision changed as well? And what we found is that stakeholders are consistently envisioning an HMIS that supports all of the care delivery needs of a modern homelessness response system. And that includes what you see presented here today. So facilitating the regional strategies and data standardization across the Tri-County homelessness response system, enabling the goals of each of the individual counties within the Tri-County area, enabling equitable access for people who are seeking care, providing an effective tool to support people who are providing care, providing a consistent tool for standardized data collection and analysis, facilitating cooperation within and across systems of care. So not just within the homelessness response system, but as Dan mentioned, with behavioral health, substance use, other systems of care as well. People desire for the HMIS to provide easy access to the information needed to make strategic decisions. And that last box that you see is making sure that any HMIS system still maintains compliance with HUD and other reporting requirements. So while that is no longer the only or primary goal, it is still one of the very important needs for the HMIS to support. All right, next slide, please. All right, so then the next thing that we did as part of our analysis was to say, now that we understand what the vision is, what everyone wants the system to do, can the legacy HMIS, the currently used HMIS, can it support this vision? And the answer is that it cannot fully support that expanded vision. And not only that, but the use of the current HMIS impacts the homelessness response system's effectiveness and limits its overall insights. So a couple key takeaways for you here. The first is that the entire Tri-County Regional Homelessness Response System relies on this HMIS system as its single source of insight. And the HMIS itself is problematic in the sense that it is siloed between programs, between counties, between agencies. It is still designed from that compliance-focused background from which it originated, and the data quality within it is currently poor as well. Second key takeaway, the HMIS hinders the Tri-County area's ability to effectively demonstrate the impact of funding being spent, measure the effectiveness of housing interventions, ensure equitable care, and efficiently meet compliance reporting requirements. This is because the data that is contained within the system is very difficult to report out on and answer all of these different questions. The third point, the HMIS is poorly designed for the current needs, again, because it was designed with this primarily compliance focus in mind. The way that people are trying to use it for the care delivery system right now requires working around it, and that is creating security, data quality, and client care issues as well. The last point being that functional and technical limitations of the current HMIS hamper the ability of the Tri-County Homelessness Response System to achieve that vision that we just described. And we're going to go into a little bit more information about what some of these limitations are. All right. So I know you can't read all of the detail here, and that's not what we're asking for. What we're asking you to take away from this slide is that there are only 8 green boxes, meaning that of all of the capabilities in this custom business capability model that we created to describe everything that people want to be able to do in the HMIS system. There are only 8 out of the 50 boxes that are fully performed within the HMIS today. So everything that is blue is partially performed, but there are manual interventions necessary to complete the work. Some of the work is done in Excel spreadsheets, some of the work is done in other systems, and yellow are the ones where those capabilities are not managed within the current HMIS at all. A few of them also have red boxes around them that just says data around these capabilities are not in the system at all. In some cases, people aren't doing the direct work in the system, but they're going in and entering data after the fact. That is not true of the ones with the red boxes. Right, and on our next slide here, we call out some of the capabilities that are lacking in the current HMIS. And this is not to say that these activities are not being performed. They are being performed. They're essential activities of the homelessness response system. They're just being done in a more manual fashion than is ideal. So some of the areas where the capabilities are particularly lacking include outreach and engagement, coordinated entry, care coordination, some provider management, reporting and analytics. And as you'll see, some of these are critical to achieving that expanded HMIS vision that we identified earlier. So with the current system having these limitations, again, that vision is not able to be fully realized with the current technology in place. All right, so there's another reason why, or another layer of information behind why the current HMIS is not able to deliver on all these business capabilities. And that is due to the technical limitations of the current system. So while the capabilities in theory may be able to be there, because of some of these technical limitations, they can't be utilized in the way that people are trying to. So the current HMIS, for example, does not support mobile compatibility for access in the field. There's no geospatial data for logging services. There's no ability to import data, which is particularly impactful for provider organizations with their own systems. So there's some double data entry that is required between their own systems and the HMIS. There are no integrations with other solutions for efficiently sharing information. That it does not support data warehousing for collecting data from multiple systems of care and being able to report out on that information. And the last one is that there are not customized analytics and dashboarding for drawing insights. We heard multiple times that there's a great wealth of information collected already within the HMIS, but it's not particularly accessible in the ways that people need to view the data and use the data. So as a result of these technical limitations and some of the functional limitations that we identified in the previous screen, the current HMIS solution again hampers the Tri-County's ability to work towards the vision that we identified earlier. All right, so in our analysis, we did find that there are some improvements that can be made to the legacy solution to help address some of the gaps. As Multnomah County takes over administration of the system, these are some opportunity areas to explore with the vendor. You'll see at the bottom, or actually on some of the pain points on the right, we heard a lot about data visibility. Again, data's in the system, but the right people can't see it when they're trying to do different pieces of the work. We heard from the system admins that they spend a great deal of time investigating data visibility issues, trying to figure out why somebody can't see something and resolving their access to it. Resolution of duplicate records, minimizing creation of duplicate records. We heard that for an individual within one of the counties, they could have as many as 20 records. And even once it's identified, it's difficult to merge them all and keep the right information. And then again, across counties, it's an issue as well. And just one call out at the bottom of that slide there is just, there are things that can be done to improve the current system, but there will be a decision that needs to be made about the appropriate level of investment to maintain in the legacy system, knowing that it's not going to meet the full vision in the end. All right. So the next thing we did was look at solutions in the marketplace to say, now that we know what you're aiming for, that we know what you need, are there better options for you in the marketplace? And here are some of the takeaways from that analysis. So the first is that there are 2 primary HMIS vendors that service the 15 continua of care with the largest homeless counts. These are not the vendors that the Tri-County area is using. These 2 vendors, which we'll talk about in the next slide, are the most likely to meet the Tri-County's HMIS vision and needs. The second is that there are additional vendors beyond those 2 that may also meet the Tri-County's needs, but are less experienced with complex COCs or are less HMIS focused. But the third point, they do offer significant functional and technical benefits over the system in use today. So there are better options available in the marketplace. All right, on the next slide. Okay, so this is a summary of our market scan. You'll see that BitFocus and Ecovia, the second column and the second from the last column, are ranked high in our ratings here. These are the 2 that are used by the 15 continua of care with the largest homeless counts. They consistently use these 2 vendors. And we looked at the Tri-County area. If we add the 3 counties together, the homeless count population is right up there with these other jurisdictions. So that's essentially the scale of that these vendors are used to working with. The other ones that you see, AdSysTech, Bonterra, WellSky with the star in it is the current solution in use in the Tri-County area. You see that they rank medium overall, medium for functional needs, medium for vendor product alignment, and low for technical needs. And then the other 2 that you see, AdSysTech and Bonterra, are broader case management solutions that do have, that are used as HMIS solutions, but they're not exclusively HMIS vendors, and they are not exclusively or primarily working with large jurisdictions. But you'll see even those vendors do offer significant benefit over WellSky in terms of their ability to meet the functional needs and technical needs that we identified earlier. And just as a quick explanation, that vendor product alignment was really about, are they experienced working with populations of our size, with jurisdictions of our complexity? Are they focused in the HMIS market, et cetera? And our market scan did look at a number of other vendors. These are just the ones that floated to the top. All right, next slide, please. Okay. So our finding based on the results of this market scan and all of the previous work was that implementation of a new HMIS will be required to provide the Tri-Counties with the desired functional and technical capabilities required to achieve that vision that we described earlier on. So in order to do this, the Tri-Counties will need to prioritize the business and technical capabilities required, determine the best procurement strategy. The procurement will require not only identifying, the needs of the system, but also business process reengineering to understand how to most effectively utilize the new system. How does it need to be governed? Who needs to have access to which functions? How are the different bodies going to relate to each other? How do processes need to be changed, et cetera? All of that is a part of making a new system successful. The third is that identifying and addressing participant, provider organization, and staff needs in advance of implementation will be critical for success. We know that it's not a matter of getting a new solution, even if it is perfect. Plugging it in doesn't mean that everyone is ready for it. What are the training needs? What are the communication channels that need to exist? Are there technical gaps that need to be addressed within provider organizations to be able to take advantage of the new software, et cetera? So those are all things that need to be understood and prepared for in advance of implementation. All right. So the last part of the Gartner project was identifying recommendations to position the Tri-County to achieve this vision. I'll go through the recommendations on the next page, but the recommendations together make sure that all of these components are in place. So the first is that the right stakeholder representation is involved in HMIS decision-making at the right levels throughout the process. Excuse me. The second is that all short and long-term HMIS decisions are focused toward achieving the same vision. The recommendations ensure that limited investments improve use of the legacy HMIS in the short term, that a fully capable HMIS solution enables the full vision in the long term, and that there is a comprehensive strategy that ensures the value of the data to the homelessness response system. And on the last page, I will show you what the recommendations themselves are. So the first one is to discuss and approve an HMIS governance model. We know that there are some drafts in place as Multnomah County takes over administration. They are not finalized, they're not adopted. We recommend doing that so that everyone knows their role within decision-making, that that adequate representation from each of these stakeholder groups is represented, etc. The second recommendation is to initiate and operationalize that HMIS governance model. So take that theory that everyone agrees to in recommendation 1, put it into practice, identify the people who are involved, the named members, kick off the meeting cadences, start prepping agendas, start making decisions so that the governance model can be iterated and defined well in advance of something like the full implementation. The third is to formally adopt and socialize the expanded HMIS vision. So that vision that we presented at the beginning of this presentation, make sure that it is bought into, that it is fully representative of what additional stakeholders are invested in, revise it as necessary, formally adopt it so that it can be used to guide decision-making as the HMIS is implemented. The fourth is to complete transition of the legacy HMIS administration fully over to Multnomah County IT so that there's the ability to work with the existing vendor, to analyze the existing system, to resolve as much as possible in the short term. Recommendation 5 is to prioritize those enhancements to address the legacy HMIS gaps. So again, evaluate what can be done in the short term, what resources are required to do that, and where the right line is to draw about what provides good value in the short term versus where those efforts should be saved for the full implementation. Recommendation 6 is to prepare for procurement and contract for a new fully capable HMIS. Recommendation 7 is to develop and implement the data and reporting strategies so that when the new HMIS is available, the data is in the system, everyone knows what kinds of questions they'll be able to answer with that information. And recommendation 8 is to prepare for and successfully implement that new HMIS. Okay, so that was a lot of me talking, a lot of information about a quite in-depth analysis that we performed. So happy to take any questions on any of the content at this point, and we can scroll back to screens as necessary.
Is there anything for you?
No, thank you. Thank you for listening. I think that's a lot of technology talk for half an hour or so. Appreciate your patience.
Sounds like an NPR program. Let's go Ebony, then Chair Harrington, and then Christina.
Do we anticipate any downtime of the system? And if so, what does that look like? How long? And what would we be supplementing that system with?
If we were to implement a new system, there would be virtually no downtime. The transition would be, it's usually something that's done over a weekend or something like that. So there would be no service impact, or shouldn't be, and we would plan for that.
So let's go Chair Harrington, then Christina, then Matt, then Mercedes.
First, I want to start with thanking Multnomah County for hosting all of this and for the wider team in working with Gartner on this whole vision and the approach of the legacy, an enhanced legacy, and a new vision. I believe there's one more slide, because between packet number 1 and the update, there's one more slide, and the new slide answers part of my need. So the new slide, for those of you who have the packet, has a potential timeline for recommended activities.
They flashed that at the end, but really quickly.
Yeah, it
Do you
came
wanna
up on
go
the
to-
screen, but it
Okay,
wasn't in the packet.
so I will note that we are in March. So I'm going to assume that what is in February, that everything has to shift out at least 2 months. So I can't function without a timeline, okay? I'm sorry. We have a 10-year program here. We're in year 3. That timeline shifted out 2 months, takes us through the end of year 4. So I'm assuming that implementing the new HMIS, which is number 8 there, might take 3 years. But I don't know that, but I have to start somewhere, which means that would take us out to year 7 to have the full HMIS. I'm not complaining, I'm just trying to map it out, which means that we either live with the shortcomings of the legacy system, which I'm tired of getting yelled at by the Metro Council saying they want full access to HMIS, when the legacy HMIS doesn't even give them what they and the Oversight Committee want. I have cognitive dissonance. Hard for me to function with that. So I hear loud and clear, we have to move beyond the legacy. And I'm going to go out to year 7 that we're going to have to live with. We have to implement an enhanced legacy, figure out how much that's going to cost, and live with it through year 7. And then as of year 7, hallelujah, in addition to all of the great services that you counties, Metro, but the CBOs are delivering in our community, we're finally, as of year 7 or 8, going to be able to get the kind of reports that people have been pounding us for. So I'm just trying to, one, checkpoint that I got the summary of we need to move with an enhanced system, and we need to go full steam ahead with the full vision. I want to know how much each of those is going to cost. And then I'm hoping that this committee will make a motion to direct Metro staff to take the Metro Council and the Oversight Committee through this great presentation, because it'll get a huge monkey off our back. That's my summary.
Thank you, Chair. So is there some clarity around?
Well, yeah, I can
just the
clarify a
summary?
little bit.
Yeah.
Yeah. I mean, in terms of timeline, we're operating under a 2-year timeline. So we're looking at about trying to target January of 2026. And in order to do that, obviously, though, we need to resource this work at a level that will allow us to do that aggressive of an implementation.
So
But I-
that's the end of year 5.
Yeah, and
2 years faster. Yay, thank you.
I mean, that's pretty aggressive, but it does need to be resourced, and those are the kinds of things that we're working through now and preparing for. I think in terms of, current state, it's not that there isn't data, and it's not that people aren't reporting great work and all of that. It just takes a ton of effort. And it takes a ton of gymnastics and things that that the data analysts and all of that have to do to make it work. We could spend a lot less time doing those gymnastics. And it would also, I think one of the other challenges is that the system is not really designed for the providers and at the point of care. And so it doesn't help the actual delivery of service. And that's part of the sort of the challenge that we want to address, is that it should help actually provide homeless services as opposed to just being a data collection tool. So that shift will actually impact more on the service side and would be really great for the whole region, so.
And for today, there's not a price tag on.
Not yet.
Right, so we'll, to come later. And then I guess I hear and ask, I think you proposed this group makes a motion to have this brought to Metro Council. Is that on the calendar? And Oversight Committee? I guess you could make a motion.
I would just propose that we leave that idea here
Okay.
and hear from the rest of the committee about questions and whatnot, because what they're proposing with both enhancements and the full vision will increase our effectiveness with the full vision, the services that
Yes.
you talked about, sir, and also help us stretch our dollars, right? And deliver the level of reports that frankly, we're getting hammered to deliver. So don't worry, I won't forget to
All right,
repeat the
I know
ask.
you won't. I know you
And I
won't.
assume that with the regional, what's the regional fund called?
The RIF.
Thank you, that there will be enough dollars, but assumption. Thank you.
To be continued with the dollar comment. Let's go Christina, then Matt, then Mercedes, then Mindy, then Chair Vega Peterson.
I like to go on to the first chart where you were showing, like you told us not to focus on the other boxes, but I saw one of the blue boxes that is like, you know, half implemented. For example, eligibility. I think that's important for us to be fully functioning because I want to know which community members are being served or not. Thank you.
Yes, so can we, Leah and Gio, are you scrambling to find a slide? So this is the one with the yellow, blue, and whatever other color, some red around the box, the yellow box. So just want to make sure folks are, right, so the eligibility piece, it was the other one, right, Christina? Or was it this one with
I
eligibility?
think it's a couple slides prior.
Yeah, it's a few slides earlier.
Slides, but it's the box is eligibility.
One more, this one.
This one, okay. And so was that a question or just a comment that it's really important that there's an ability to track the eligibility?
Yeah, it's a question like because right now it says partially perform. I want to know when is it going to be full perform, and I wanted to express the importance to me of why it needs to be fully working.
Yeah, so it's labeled as partial. You got this, Sam? Thanks.
I mean, in terms of, you know, when this is really to identify the functions and capabilities, and just to kind of call out too, none of this is prioritized. Some of these are more important than others. None of that's been done yet. This is really future, you know, when we get to a future state, we would sort of prioritize and figure out those kinds of changes that we would need to make. But again, we wouldn't necessarily invest in the current system if it requires more cost and that kind of thing. So it depends on what it is. But obviously, all the things in there, you know, would be its relative importance. We would need to figure out in the next system and how to make it better.
Great, thank you. Matt, Mercedes, Mindy, Chair Vega Pearson.
Yeah, well, first off, yeah, a comment and a suggestion. The comment is, I think this is, you could bring that down. Thank you. The comment is, this is one of the best presentations on this kind of a thing that I've ever seen. And throughout my career, I have seen many, many, many of them. A lot of which were by Gartner. I have a high respect for the group, and it's always been very, very well done. So this is excellent work. And sometimes I think we don't spend enough time acknowledging when things are really, you know, an A+. I would give this work an A+. It's very difficult to make these kinds of transitions. And the approach that's been taken is proposed. I guess it's not final yet, but I hope it will be very soon. That is the approach that is needed, in my view. And as I said, this is an area I have a lot of experience that we've just got to go through. And the reason I'm really stressing that comment is that if we decide that we want to speed it up, but we compromise some of the implied steps that are in this, it will fail. So my caution, I share Chair Harrington's frustration. I don't get yelled at like she does and all that, but it's been one of the biggest areas of frustration to me to see how inadequate the current system is. I think it is not salvageable for the purposes we need. but we must go through a rigorous, disciplined process to get from point A to point B. So that leads to my suggestion. One of the comments that was made is that there are detailed analysis and reports available on these things. And I think it was item 5, is the what are we going to do in the meantime to make life a little better? So my thought is this, if there is a detail behind that, I would greatly appreciate an opportunity to review it and perhaps to chat with Gartner or Dan or whomever as to how we might do that. But much more importantly, and this is where Christine's comment, I think, is so critical, and it illustrates that there are stakeholders throughout who have particular needs based on the acute nature of their pain points. So as we go through, and if I understood what I think it was Dan had just said, that those decisions, that process is not yet underway. I would, it calls for moving on that right away, which is appropriate. And as we do that, I think perhaps having a group, maybe within some of the people who are on the TCPB, there's a tremendous amount of expertise within our body, but whatever, to be sure that we have reached out to stakeholders and identified the pain points that are most critical, and we can compare those to the areas that are most klutzy and make some judgment calls. And the sooner that we can do that, the better. There are methodologies for band-aiding some of these kinds of things. Much of it involves putting other systems in front of the existing system. That has been done, I think, a little bit with things like Salesforce, which is a database-oriented bit. And I think we could alleviate or at least mitigate a lot of these pain points, but focusing in on that and maybe asking for an interim report in a couple of months, whatever's appropriate, as to what pain points are going to be mitigated, how, by when, and at what cost, obviously, would be helpful. So anyway, really well done. Thank you very much. This is, to me, very exciting because this has the potential to solve one of the biggest problems that we face in our homeless crisis.
Great, thank you, Matt. Some good ideas for next steps. Let's go Mercedes, Mindy, Chair Vega-Peterson.
Thank you. I also want to say I really appreciate this. I think it's really incredible to be kind of grouping all of these capabilities together. And I really, really appreciate the comment you made just a second ago about making it improving service, making it easier for people to get service. And so with that, and you kind of started to talk a little bit about my question, which is at some point, we moved to like finding a vendor where like, here's our grocery list, here's what we want, maybe there are vendors out there who are like, we can do all of these things, totally. And others who are like, let's have a little bit of a reality check and you can't have all of these things. Where do you kind of expect that to happen in that calendar of processes? I think you mentioned something about prioritization so that, maybe there are things that are currently being done outside the system. Like I think one of them was like data visualization, maybe that's okay that is a separate capability. Like where do you see that falling into that timeline that you all shared?
Yes. So the timeline really is sourcing in the like July to the end of the year time period. So in the sourcing process, we would evaluate sort of the trade-offs of technology of what's what each product might have, what their strengths are, what their weaknesses are, and then kind of go from there. But I think one of the key things we are looking for in the technology is not necessarily all of the features and functions, but also underlying technology around like integration capabilities, platform capabilities, the abilities to like just be able to add things in the ecosystem that we can't do today. So maybe one product doesn't cover all the needs, but it has the capabilities to support other products connecting with it or other sort of types of tools that might be able to do the work. So we want the flexibility is also one of the key functions that we would want to get. In terms of the selection process, I mean, we're going to need to design a selection process that brings in a lot of input from different partners, from provider, community, and so on. So we're designing that. We'll be working to design that over the next few months to try to get that released in July, which would incorporate all that.
Was there a piece around prioritization? So is that part of the capabilities, strengths and weaknesses analysis is incorporating? Okay.
Yeah, usually in the selection process, there's a prioritization of requirements, and we would prioritize those capabilities and then weight them in terms of how well they're met by each vendor.
Awesome. Let's go Mindy and then Chair.
Yeah, first, just another thank you and a ton of support for heading in this direction. And I just want to say, I got to meet Dan during the early days of electronic health record implementations. And so if this guy can handle that, I have a ton of faith that this is going to work out. You got a lot of needs to meet in this, so take this for what it's worth. But with Oregon moving forward with the health-related social needs benefits, outreach and engagement is now going to be fundable by Medicaid. A lot of those eviction prevention services. So if there was a way to do billing easily inside of that, just want to put it on your radar. Again, I know you have a ton of needs to meet, but it's a revenue source. And then the other thing is that the state has been working really hard on HIPAA clarification, so health information sharing with community-based organizations that are providing those sorts of services, and have come up with some really creative solutions to make it so that interoperability will be, and again, you have a lot of needs to meet, but thinking about how we might have the capacity to share, especially care coordination information and that sort of thing, be useful.
Thank you. Okay, more on your plate. Chair?
Thank you. So before I made the questionable life decision to get into politics, I actually worked in the tech industry for over a decade. So I am really fired up about this project. Min and the whole team at Gardner has been fantastic, and this is the second time I think I've been walked through these recommendations, and I'm just really committed to this work. And I will say, this is something where I appreciate Sharon Carrington, the kind of urgency of how can we make this work happen, because everybody wants to see this happen. Everybody knows our HMIS system currently isn't meeting our needs, and then we've got so much work to do. And I think when you look at the state of homelessness, maybe a couple decades ago when we were first looking at this, and where we are today, we need a more robust system, and this has made that abundantly clear. So I'm really committed to this, and I'm really excited to be working with this group and talking about how we can regionalize this and use some of those funds to move this work forward. But I just want to thank Dan and everyone for all of the work that's been happening on this at the county. It's great, and I'm here and ready to do what we can and what we need to do to really make this happen and make this happen as quickly as possible. I went to an Oregonian editorial board right before this, and they were asking about data and HMIS, and so everybody really wants to see this happen. So this is really great, and thank you for bringing it forward.
Thank you, Chair. Let's close with, Mike, I think you were actually first. I didn't see in the corner, and then we'll close with Sahan. Thank you.
Thank you for the report. That was really great information. I want to start off by saying I don't live and breathe all this information on a day-to-day basis. It's not my day job. But from looking at the report, one of the things that jumped out to me was we're talking about kind of inventory housing management. I'm just using this as an example, but it was one of the items that we set the capability that we're trying to build within the HMIS. Are we duplicating some stuff? Like, we look at the long-term rental system, are they sort of building a database as well? And how would this tie into any new HMIS system? So when I saw that, I just want to make sure we're not being repetitive or things that we're agreeing to piecemeal on other projects. Like, we don't want 20 different systems at the end of all of this. How are we truly going to tie all of this in together? And another thing, and probably for my clarity, how does this tie into something like Built for Zero? Is this the data that Built for Zero uses? Are one of these vendors what Built for Zero uses, or is Built for Zero a completely different system all in of itself? Because we always get referred back to, this is what we're going towards. This is the system they use that has access to inventory, to access to all the health information. And I just didn't see that as one of the vendors listed, so I just don't know that answer, so.
Okay. I don't know, Min, if you want to speak to inventory or housing management or any of that kind of piece of it, or I'm happy to talk to it as well.
Sure. Yeah, I'll address that a little bit, plus the answers also helps address that prioritization question that was asked earlier. So the business capability model that we put together represents what everybody has asked for. But as was voiced in the room, there's absolutely decisions to be made about whether the home for that capability should be in the HMIS or whether it's successfully served elsewhere or should be. Those were outside of the scope of our analysis. We're just presenting the topic. So should data visualization be done in Tableau as a plugin? Totally valid, right? So, but somebody needs to make that kind of a decision. For inventory management, we actually didn't go deep into like property management type capabilities. We understand that that's being managed well elsewhere. So we did not go into depth in those. We don't have an expectation that the HMIS would fully duplicate those efforts. The intent is not to. But there are going to be decisions to be made for these capabilities as you fully define your requirements for a solicitation to say, this is exactly what we need, these things are covered, these ones are nice to haves, et cetera. And then as Dan mentioned, once you are looking at proposals and evaluating them and weighting, which things we absolutely need to have, which ones are nice to have, then there's another round of decisions about, what do we need as the core of this system.
Thank you. And then I'll also speak to the Built for Zero stuff. I think I'm not an expert in Built for Zero, but my understanding is that it's more of a methodology around how you collect the data, not necessarily the tool. And so the organization that's involved in that is really an advisory organization, not like they provide a product. And so I think whatever software we use needs to support the process and the methodology of how they validate an individual's identity and all of the attributes of that individual, which is, I think, what's key in terms of the Built for Zero frameworks. And then I think it's also related to outreach and other tools that they need in order to support that process, is my understanding of Built for Zero. But I don't know if we have any joint office people who can speak to that, but I'm not an expert.
Yeah. Ooh, can folks hear me okay? Well, I am definitely not the expert on that, but I do have a little bit of information that I can share. So when it comes to Built for Zero, folks effectively use some form of HMIS regardless of what the software is or however we're, developing that. So there is a component that comes from that and how folks pull it. And to not mess up my notes here, let me take a look real quick. Some of the Built for Zero communities, again, just kind of utilize the same system that we have. So it's a matter of just like, what is that underlying system that's putting HMIS forward rather than like,
System itself.
Yeah, the system itself. If that added clarity or if it added more questions, I also know Lori Kelly is on and the participant if you want to ask her.
If there's more questions, they're going to have to come in another time. So let's capture that, Built for Zero, we won't lose it. And just to note, so I'm going to go Sahan, Yvette, Matt, I see your hand, but I'm going to ask you to use the post-meeting survey and follow up for any other questions. I need us to move on to our landlord recruitment. So let's go Sahan and Yvette, and then I'm going to move us.
Thank you, Ben. I'll try to be fast, but no guarantees.
Guaranteed.
I think my mind might be a little bit too simple and need some help to figure out why this is as complicated as it is. I also thank you, Dan, for the presentation. I think it was great. And it also feels like we have a huge head start because of the work that's already been done. Like I look at this, I see our current system is insufficient at best and pure unadulterated garbage at worst. But we only have 8 of the 50 capabilities that we need. I see recommendations for 2 vendors that are far better. And what I'm reading is we have 15 examples from other COCs that have higher homeless counts than ours that use one of those 2 systems that we can use as reference. So when I see that, I see, why don't we just look at those 2 systems? Which one gives us the capabilities that we need? Does one have 40 of our 50, 46 of our 50, all of our 50? What do those 2 systems cost? We pick one, we move. Why does this have to be as complicated as it feels like we are trying to make it?
Succinct answer about
Succinct
complexity?
answer. In terms of public sourcing and procurement, we need an open process that allows them to actually put forward their own best effort to be able to evaluate all the products. Certainly Gartner did a lot of homework there, but we need to do that evaluation from the ground up and do it in our sourcing process. And that's just by rules and regulations in terms of how we buy things. I think the bigger lift here is doing the transition to a brand new system where you need to redesign, rebuild, rethink how things have been done. And that work takes a big team of people. Not only that, you have to train and disseminate it out to 150 provider organizations out in the community. That's a big effort. And so really, I think it's less about it's a lot about the tool, but it's also about how you implement the tool, the types of training, the change management, all those features, or all of those sort of things that you need to do to make it real. And so that takes a lot of time and a lot of people.
Thank you. Let's
yeah.
go, Yvette.
I just wanted to say that I'm so excited about this. This presentation was so I saw it all. I saw the system working and it felt so good. Just thinking like how it would help so much of our providers that are out there, working with these, our homeless population out there. They need a little bit, it needs to be a little bit more easier for them. They do a lot of hard work face to face. And so having like the mobility capability, being able to case conference, see that information, the dashboard, all that is like literally Christmas. It's just beautiful, to see that we're bringing everything, that we can bring things together and really, really collaborate with each other as, three, as a regional, what we're trying to do. So I'm a little bit excited, but it's just so wonderful to see that because I have worked with the HMIS. So going from that to seeing all this, possibility is really amazing. And I also agree with the housing inventory management. I know that we have something that might be, that is going to be in place, but if that is something that might be available, that might be something just to look at down the line so that we have everything in one system and not like breaking things up. So thank you.
Thank you. So,
thank you.
Chair and Matt, I really do need to move us on. Patricia, if you want to yes, well, we don't have to take action today. Patricia, were you going to name something?
How does that impact the schedule?
There's not an ask of this
So,
group.
so this was an informational presentation to update, kind of close the loop on what the group requested was come back and let us know the results of that, those findings. So that was today. I do think it's worth noting that, it's been mentioned that we need a new vision. This is an opportunity for us to think about what kind of infrastructure is going to support the vision and the thing that we want to build. And so I just want to shout out Multnomah County. Thank you, Chair Vega Peterson, who isn't here. Thank you for the leadership, because again, this is happening tangential to us, right? It's not something that Tri-County or Metro has had really a participation in. We're just kind of being informed about what that is. And I think it's worth noting that, based on what I'm hearing in terms of the interest, it is something that you may want to consider in terms of funding. There will be one-time costs. It is regional in nature. Again, I think it's for your discussion and discretion about what that could look like, but I see it as an opportunity, and I thought it was worth mentioning.
Great. So I'm going to move us, Chair. I'm sensing your. Could you talk about next steps, Dan?
I think we would, next steps would be for us to come back, if we were to come back and give you updates, and then if there's a budget ask or any sort of support that we would like for the project, that we would come back and bring it here for that consideration.
There's a slide in the packet, potential timeline for recommended. I assume that you can't move forward.
No, they can, I think it's the only piece for this group would be once there's a budget attached that connects to the RIF, the Regional Investment Fund, thank you, I knew there was an I, right? The work is happening. I think I heard Chair Vega Peterson express enthusiasm, group here expressing enthusiasm. So I don't know that, yeah, Patricia saved me from.
Yeah, I was just going to say, so this project doesn't require our funding or approval because Multnomah County is moving on this, is my understanding, based on the chair's comments. And so this is their project that they are informing us that they're doing, and connecting that dot to this committee with the interest and relationship to SHS, there could be a budget assets comes back to this committee, but I'm hearing a commitment from Multnomah County that it is moving this project forward on a 2-year timeline with or without this group.
I think funding would need to be secured by the end of the calendar year.
But without a budget ask, there's no action for this group, certainly in terms of the Regional Investment Fund. Okay.
Thank you.
And the work's continuing, there's no stop, thank you, I need to
Thank you
move
for
us-
having us.
Do we need to vote on that, can we just commit? Fair. Right.
Chair Harrington, we'd be happy to. Yeah, we don't necessarily need a motion. We'd be happy to bring this to
Captured in the
Oversight
notes,
Committee
in the
and
notes
Council.
for the record that this presentation will be made available for SHS Oversight Committee and Council. It will capture it in the summary. I can look at Colin right here and see that he's capturing it. I need to move us on, and in the spirit of where Yvette kind of left us with her excitement around we can do things, and we can do things regionally. I'm going to hold what you brought into the room. So hopefully folks understand what we're going to do right now is we're going to hear a presentation high level. Hopefully folks had time to absorb what was in your packet with the work that Metro and counties did. We are going to go do a round robin. Mindy, I'm going to call on you earlier because I know you have a time sensitive. I'm going to ask at each person gives that initial assessment. Are you a thumbs up, sideways, or thumbs down? If you're thumbs up, you can say nice comments, we can move on, you're ready to support. If you're a thumbs sideways, express your considerations, we will capture them. And if you're a thumbs down, express your concerns, and you need to make a proposal to move forward. Yes, everything.
I would just like to set the intention before we get into this next part. This is meant to move this along. Of course, there's going to be concessions that need to be made. At the end of this, questions asked, but concessions be made, I guess, depending on what we're asking for. If something looks good as an overall idea, then maybe we're just looking for some fillers for that plan. But moving this forward and then adding our concessions, whatever concessions are not responded to today, please make sure that we either email or I will stay over, type them up, and then get them over to Metro at the end of this meeting. But that is the intention.
Yes, we're committed to capturing any concerns that are raised that are a concession or consideration. We will capture those. We're looking for folks, to Ebony's point, can you live with it? Like, are you gonna, I shouldn't even say it like this, are you gonna get in the way? But if you're gonna get in the way, you need to propose a solution, okay? So let's go, Valeria, if you
Great.
can open us up, please.
All right. Thanks again. My name is Valeria McWilliams. I use she, her pronouns. I'm the Regional Alignment Supervisor. I'm very excited to be here today co-presenting with my county colleagues the first implementation plan to the committee. This is the first time that you're being asked to review and approve an implementation plan, including a financial investment from the Regional Investment Fund, also known as RIF, for the first goal area, the landlord recruitment and retention. As we sent in the email, meeting packet email, our expected available balance for the RIF this fiscal year, which includes amounts carried over from the past fiscal years, plus new RIF funding, is about $41.2 million. TCPP approved the template and elements for an implementation plan last year. So with that direction, the Metro and counties have worked collaboratively and swiftly over the last 3 weeks to develop this plan, which includes program descriptions, timeline, preliminary budget, and metrics. So today we're requesting that you consider a vote to move forward with this implementation plan. TCPP members can expect a vote on an implementation plan like this for all of the 6 goal areas. We're really confident that these strategies will be able to propel us into action to increase the availability of readily readily accessible and appropriate housing units. In your packet, we have also included a landlord commingle timeline that has memorialized the engagement that this committee has had since identifying this goal as a regional priority. If you vote to approve this plan, next steps are that staff, along with your co-chairs, will be requesting final approval from the Oversight Committee next month. I will pass it now along to Brianna from Multnomah County.
Can you hear me okay? Awesome. So thank you again for the opportunity to come back and be able to share this. We're going to go ahead and start just by leading in with some racial equity considerations for this portion of the work and the plan that we're bringing forward with you. So just framing up and teeing up this conversation, when we're having discussions about strategies that are going to be taken on at the regional level, we really want to be mindful and intentional about how equity is showing up in this work, and specifically knowing that there has been historical and deliberate things that have happened that have led us to where we are today, where folks are experiencing there's racial disparities in housing. And we want to make sure that we're approaching this work with intentionality and how we're moving through that, to make sure that we're aware of those things where we could either be helping to move this work along or unintentionally harming. So we wanted to take the deliberate pause here for being able to do that. And through these plans, you'll see that we have considerations for racial equity. This is up the top, and I think we had mentioned this the last time as well. Instead of having a racial equity goal tied to this specific one, we really want to bring it up to this overarching strategy, and we'll make plans to do this with all of the other goals that we bring, that we work to address. So this plan really is our first opportunity to be able to create that regional response when it comes to increasing access to different units across. And today the counties come forward to be able to share that we are committed to this process and moving through it. We are fully aware that as we move up and build up our processes, equity work looks a little bit different in each of the counties, but we are committed to being able to have those equity recommendations come forth, and for our designated equity staff and leads be able to move this work forward. So what we're proposing is for those folks that are designated, as this work continues to move on, to be able to convene with each other in ongoing conversations about the racial equity impacts, and also be able to give something tangible to folks by utilizing a racially informed equity lens tool and being able to talk about what racial equity means at the regional level. So again, this is just our first iteration of being able to do that for folks, and just really appreciate the opportunity to be here. And thanks. And I'll go ahead and pass it to Nicole, right? Is it you? Okay, go ahead.
Hi, everyone. My name is Chris Pence from Metro. The first strategy, next slide, please, thank you. The first strategy is a communication and education plan. This is a regional communication plan, and it aims to increase awareness among landlords of our various voucher programs, the benefits and the incentives for getting involved in those programs. So Metro, with input from the counties, will hire a consultant to lead this work, to recruit landlords, and there's going to be an intentional focus to the equity concerns about reaching Black, Brown, Indigenous landlords and other non-dominant culture landlords. And then the Metro hired consultant specifically will be summarizing the incentives of the various voucher programs, building a web page and creating marketing materials, and then gathering feedback and input from landlords. The county has requested that Metro take the lead on this contract, and also hosting the webpage on our website, and we're more than happy to support that. The anticipated cost is between $50,000 and $150,000, and the goal is to have the webpage live by fall of 2024, and the campaign will start by June 2025 and reach 200 unique landlords. When I say landlord, property management company, mom and pop, really the gamut. Yeah, that's it. Moving quickly to the next one.
All right. And as Chris mentioned, with the aligning financial incentive strategy, we will be leveraging the contract from Strategy 1. So we'll use the communications consultants to also build out training materials for providers to make sure that there's kind of clear and consistent communications to landlords across the region about the existing financial incentives, and that they're being applied equally to all ARLA participants. One key thing that was raised by our landlord liaisons in particular was the rent insurance benefit, making making sure that folks understood that if it's an ARLA household that they're renting to, that there is that support of rental of renters insurance, and we're able to move that forward. So that's a piece of the training and a piece of this goal. The other piece of this strategy is looking at the existing incentives for SHS funded programs, for federal programs, for state programs, and seeing if there's opportunities to align those incentives and in particular understanding the costs of what that might be. There's a lot of work left to do to look at those different incentives, determine what would be the delta in providing an ARLA level incentive to, for example, a housing choice voucher. So we just have a lot more work to do to understand what that final cost would be. The cost for this would both support the communications consultant and potentially bringing on consultants to support training or augmenting staff capacity to support training. We estimate that to be $100,000. And we hope to have this work completed and wrapped up by winter of this year. And I believe I'm passing it to Adam.
Can I ask a clarifying question on the timeframe? Winter means January, February, March?
Microphone?
Thank you. Winter means January, February, March. March 2024? Like this month?
I think you're thinking winter starting in this December of 2024.
That's January, February of calendar year 2025 then?
Are you talking about this later this year?
Yes, we probably should have had a slash of December.
Washington County calendar
Okay.
is, summer is Q3, calendar Q3. Fall is calendar Q4.
Just share, if you all mean later this winter or later in fall of 2024, let's name it fall of 24. Is that accurate?
Our intention is kind of the solstice winter, December 21st to the end of the solstice winter. So we can certainly update it to be winter 2025. The intention is towards the end of this year or early next year.
I'm just going to capture it as a consideration and a point of clarity that we're talking later of 2024, moving into early spring 2025. Thank you. Thanks, Chair. Where's it going next?
Yep, and it's me, actually, because, yep, we'll go ahead. Can we get the next slide up, please? Awesome, thank you. So for this particular one for tracking access to unit inventory, as folks are aware in this room, that there are a lot of different tracking systems available for how folks are accessing units across our region. And so this is an attempt for Multnomah County to really take this on as part of informing the region on what having a centralized platform for tracking units and acquiring units could look like. So what we're proposing here is for the next fiscal year to be able to pilot this and really be able to look at the regional implications of what this work could yield. So with this, the anticipated costs are $810,000. And really what is rolled up into this is FTE, there's a COLA, and then there's also the anticipation of additional services that may be needed to be able to look at this really within that context of the regional work. So we're anticipating that. And one thing I wanted to mark for clarity here, so as you look at the metrics and the timeline, there is a little bit of a difference in what we had put forward. It was just frankly a typo on my end, so apologies on that part. But what you'll see is what we're looking for metrics and goals associated with that is in the packet it says 10 property units. That is not the case. We're looking for 230. So a significant difference there. So if that caused alarm for folks, I apologize about that. But we're wanting just to change that here for the point reading. And I'll go ahead and pass it to Adam.
Yeah, thank you, Brenda. So when I think about the relevance of quality problem solving, I think back to a conversation that we had with Multifamily Northwest this past summer. So with Chris's leadership, we were working forward.
Can't hear you.
Can you hear me now?
Oh, yes, much better.
Great, thank you. So I think back to a conversation we had last summer with Multifamily Northwest when we were really trying to streamline the process for our regional long-term rent assistance program to access housing units. And we sat down with Multifamily Northwest with the desire to forge a relationship to streamline that process. And I went into that meeting thinking that we were gonna have to make a case for access to the units, and there would be a reluctance to make units available to the households that we wanted to house. And I was really surprised by the response. The multifamily board immediately understood our desire to meet community need, shared the goal to meet community need, and wanted to figure out what they could do to help us meet our shared community goals. But one of the things they immediately pivoted the conversation to what I would call like solutions-oriented dialogue. They wanted to start talking with us right away about the challenges they see for households, the shortcomings they see in our system with case management versus like tenancy support services, which is more of what we're talking about here. And so at Clackamas County, at least, we've been really eager to launch a program like this for some time now so that we can be more responsive to our landlords. So this component has what I think 4 primary pieces. So one is streamlining the efficiency of our responsiveness for landlords. So logistically, this hotline would serve to consolidate the information and contact responsibility, relieving the landlord of the burden of having to track down everyone's case manager and know when or how to contact them. The second piece is responsive and tailored support. So, you know, if the issue that needs to be addressed is, say, conflict between an Arla household and another tenant in a housing, in this housing unit, the case manager can't be a neutral third party to help resolve that conflict. But within Health, Housing, and Human Services at Clackamas County, we have a whole resolution services team that does community mediation. And so we thought, well, hey, we can plug in that type of mediation service to step in and help support these households. The third piece is system integration. So similarly with the community mediation support that we might be able to provide, Clackamas County operates 24/7 crisis line, right? So if it's someone in acute behavioral health crisis, we feel like consolidation here can help us link the systems and be more responsive to meet the landlord's needs. And then finally, the final piece, which is really speaks to our obligation for continuous quality improvement and continuously improving the level of support that we provide households, is the information that we'll glean through this pilot program. So if we find that a large portion of households we're serving have hoarding challenges, for example, then we can establish contracts with organizations that can step in and help resolve hoarding issues. So I think we're really eager to see that data collection. What does the universe of common concerns look like, and how can we take what we glean to make sure we're plugging in other supports to adequately support these households and help them maintain stable housing. So Chair Harrington, you raised this conflict around winter 24 versus 25, and I think that's showing up here. So we want to get this going by this coming winter, and the anticipated cost now is $500,000 for a 1-year pilot.
This coming winter, starting December 20th at the solstice. Okay, thank you. Going into early 2025, thank you.
Yeah. We're coming out of one
And then
winter.
is there, was there a next one? Is there one more? Who's doing number 5?
Chris.
That's me, just getting the mic on. Thanks, Adam. Number 5, strategy 5 is investing needs for property management, specifically looking to study mission-driven property management. This strategy is actually a TCPB-initiated strategy suggested by our own Mercedes. So generally speaking, property management companies are for-profit. They're hired by private owners and are incentivized to maximize rental income and minimize operating costs of staff, maintenance, and other expenses. Their incentives often don't align with the needs of our programs and of our organizations. And so especially for permanent supportive housing buildings where the entire building is, or a significant part of the building is a housing program for people with a high level of need. We believe there could be a great benefit to having mission-driven property management company at that building. And while there are some small mission-driven property management programs in the area, this study, this investigation would consider dramatically scaling up those programs and consider the benefits and feasibility of that, and would recommend strategies on how best to do that. So Metro, with input from the counties, will hire a consultant to study this and provide strategies to us on how we can make mission-driven property management a much larger piece of our system. And we'll be convening work groups and keeping everyone up to date. We anticipate this will cost between $50,000 and $100,000, and we hope by spring of 2025 that we'll have one or more strategies that we can start to implement. The reason this is just a study is because it wasn't meaningfully covered by the Focus Strategies report, which is why we're having to go back and do some more research. We'll also be working in close collaboration and alignment with the state, learning anything that they've worked on regarding this, and then also sharing our feedback with them because we think this is something that could be really beneficial statewide. Thank you.
Thank you. Is that the last slide? Oh, no, we have one more. Yes, go.
Just a quick summary of what was requested by Councilor Lewis last time was that quick snapshot of the financial breakdown. I do want to call out, it's changed a bit with more additional resources for the Strategy 3. And also want to call out, we'll need to work with our consultants, understand their scope of work and negotiate a final price. But this is the realm in which we think it will take to accomplish the strategies we're bringing forward.
Great. So I'm going to actually ask that we do the roundtable, and if you have questions, use that place to do it, just because I'm looking at, I'm looking at our time. I'm going to start, Christina, I'm going to start with you. I'll call you out. I'm going to model. Mindy had to leave early, but she did a good modeling. She said, I'm a thumbs up, and I thought it was great work. So it's good modeling if you're in support, right? That's how we're going to move through this. If you have concerns, then name them. So Christina, I'm going to start with you.
Thank you. I am in support. I want to make a comment on one of the slides about insurance. I think I'm a strong believer about giving the incentives for homeowner for insurance so tenants are protected. At the same time, many of you might be aware that there is a law that says there is some exceptions to the insurance requirement. I'm specifically thinking about our elderlies. Their income is so low that they don't qualify. They cannot pay for renter's insurance. If they are to offer this program, the problem will be solved. But at the same time, I'm a stronger believer that we should use all the tools to keep people housed. So if there is a way to give that education to the landlords, or have a handout so they know that if for some reason those low-income renters don't qualify for renters, this program or whatever, or they don't want to, that they don't have to because this protection that they have. Thank you.
That's very, very good. So we're going to capture the notes as folks go along. So I'll just call on folks. Yvette? Your thumbs up. I see your thumbs up and a smile. Is that all good? All right. I love good modeling. Zoe? Thumbs up. I love it. Steve? Sideways. You're sideways, but you got to articulate. You're on mute, though. I think you muted yourself.
I did. It's a great start. Lots of food for thought here. I'm glad to see that landlords are also involved in this discussion. It's very important to talk to landlords, the associations, existing landlords, and those who are not working. Each one is great, like the financial incentive piece. There's a whole lot of rent assistance programs that could enjoy, particularly if they're the same population, have an ARLA overlay, if you will. So I'm very excited about that. I think the Housing Connectors thing in Multnomah County has great promise. I'd like to see that happen region-wide. The 24/7 hotline I had concerns with, I think it was a good presentation. I do think there's a lot we could talk about which is the best way to kind of really work hand in hand as problem solvers for landlords. I do not think case managers should do all this work directly by themselves, and there should be some support to deal with real estate. So I like what Clackamas County is proposing. Clackamas County is a lot smaller than Multnomah County, for instance. So I think it's really important that we kind of think about this, and maybe this doesn't have to rest in government ultimately, but I'm glad it's being started. And the fifth one, I think is important too, in the sense that we should look at other options, and we should look at other forms of housing that Monta brought up last time, the master leasing aspect of floors. And we have buildings, property management company like Central City Concern does property management, and they're mission-based, but it's particular populations. But I'm getting at the fact that we should be creative here when we talk about landlords, particularly with very hard to house individuals and families. So I think it's a really good start. I'm voting yes, but I just want to be able to talk. So thanks.
Oh, yeah. Thank you, Steve. Matt?
Yes, so I'm a yes. I really appreciate Steve's comments. I might have made some of the same, but I will just echo that I'm with Steve on all fronts.
Thank you, Matt. Counselor Lewis?
I think this is looking good. So thank you for the work, and in particular for the one pager with the dollars and cents attached. Appreciate it.
Great, thank you. So let's get in the room. Monta?
Thumbs this
Sideways,
way.
yep.
Just to note, we still haven't seen what happened to all the other goals that was given. So would still love to hear at some point what the plan is for those.
Okay, you're getting some yeses, not on the mic from Sahan. Will you want to jump in real quick, Valeria?
Is this about the goals that were identified and
Other
why?
focus strategies?
We had a crosswalk as an appendix to the implementation plan, and we provided rationale of how we embedded some of those into these strategies, and then why we didn't decide to move or prioritize these ones right now at this point. So happy to chat further about that.
But worth a further look, right? And noted for the record, and that's your sideways. Yeah, it's fluctuating. That's all right. We can fluctuate. We can fluctuate. Mike, please.
I'm a thumbs up on the plan as well. A couple things I wanted to bring up. One is in regards to like the hotlines. You know, we're struggling with 911, we're struggling with ambulance, and we're struggling with a lot of other things. So if we're gonna work on these plans, we got to make sure that they're well staffed. Because if landlords are part of this program and they're calling and they're on hold for, you know, a really long time, those are going to be issues. So I just want to bring that up. And another point of clarity, I'm not too sure on is, as TCPB, we're approving, I thought like the vision or kind of getting a concept to the point of implementation is sort of where our responsibility is cost-wise. And the one thing that's just standing out is the $6 million on risk mitigation, right? How is that our responsibility as TCPB? I would think at some point, some of these costs, yeah, to stand up a program, we gotta put this much money in, but at what point do we go back to the counties and go back to the SHS dollars and say like, this is a program we need to set up and this is the portion each county has to contribute to it? Because we're on, you know, this is just one goal, right? And I'm just asking for clarity because I don't fully understand that. I'm not saying.
We see our electeds are having a reaction, so.
But as someone on TCPB, I think we are just supposed to get a plan approved, and then from there, we're not supposed to fund the whole thing, right? And are we, or are we not?
Who can answer the question, right? Like what you're approving is basically the approval to spend RIF dollars on goals in a regional plan that you've identified, right? Is that an accurate way to describe it?
Okay, well, the $6 million stands out to me a little bit.
As you recall, moment is with the SHS
Microphone, probably?
I thought I hit it. It's on.
Oh.
I'm on. Can you hear me?
I can hear you.
Okay. With the SHS money distribution, each county has to sequester a certain amount for this regional work. This is the regional work that needs to be funded out of that collection.
Yeah, that's,
So our role as the committee
And
is to
I
hear
guess
the
for me,
request.
I agree with all of them. The $6 million gets to me in terms of what, that's like an insurance pool that we're putting together, right? Like, how does that fit into the whole concept of what we're trying to do?
Would it be helpful if that cost was broken down? If we can get that, maybe get the cost broken down for that and exactly what will be spent within that 6 million, so that is broken down on, all right, is this going to be for, like, within risk mitigation, what does that look like? Does that look like trainers? Does that look like insurance dollars? What will those things cover? How many people projected served? All those things, would that be more helpful?
Probably, because if it's
Okay.
just a reserve of $6 million, I don't think TCPB dollars should be used for that, and that's the only thing I bring up.
I'm out of my depth to, Valeria, do you have a reflection?
Um,
And then I'm gonna keep us
I
going.
mean, right now, that is the current budget that's already being used, so we're not asking you specifically to vote on that, because that's already a program that's up and running, and those funds have been reported in the quarterly reports, the SHS quarterly reports. So I don't know if that's
Let's
just
have our,
clarifying.
let's see if our finance guy can say something, but, and then I'm gonna move us on, because Mike is not getting in the way of this with a thumbs up, but I do wanna make sure there's some clarity.
And Michael, you're right that it functions like an insurance program or kind of gap in insurance. But the dollar value here is the anticipated claims utilization amount that we've projected for 1 year based on, so the claims utilization is a function of the units that you have online, right? That produces a certain amount of risk that damage will occur. And so we've estimated, based on other programs, the claims utilization rate, and then set aside this amount of money that we think would be the annualized cost of servicing those payment requests from landlords. So it will take a few years to assess the claims utilization rate in actuality, and it will fluctuate from year to year. But this is the estimated annualized cost.
So what I'm gonna suggest is, hopefully that helps answer like what it is, and then I'm gonna take your last comment and say that's an important crosswalk for this body to actually make it real, right? What were the actual claims over time? Is it aligned with the number? Is that a fair way? One more time, let's try.
Philosophically, I just
Okay.
have, I need to probably
Mike,
talk
we're
to
also
someone a
not
little bit.
approving that dollar amount. So that dollar amount is not for us to approve. That dollar amount is already for their pilot project.
I agree, and I understand all of that,
Mm-hmm.
but just as TCPB and the dollars we're using, I just need clarification for
I'm just
myself,
Those
and
are
I'll take it offline.
Just real quick, so I'm just gonna say, Michael, put a thumbs up, right? So he's raised his concern, we'll capture it for the record. Let's make sure if you have additional questions that we can come back and get to some real clarity.
We,
Nicole? Oh.
and we'll make a note, we'll be happy to follow up with you, Michael, and provide more of the information to the rest of the committee via email, if that's helpful. Yeah,
Thank you.
let's do that. Okay.
Nicole?
I also appreciate getting a detailed proposal for this implementation plan. I do have some overlapping questions with Michael. I thought strategies 1 through 5 were presented really well and clear, and love seeing the metrics and the whole process. But for strategies, I guess they would be 6 and 7 under existing work. It's just, since it is a big ask, a big majority chunk of the money that's going toward that funding, since it's a $7.8 million ask and 6 of it is the risk mitigation and the other part is the staffing. It would be great just to hear more details about that portion. Because I think, like Mike, I'm just a little bit unclear in terms of what dollars come from the general SHS money that's going to counties versus money that comes from the TCPB's RIF, and how you would specifically differentiate that. And if it's existing work and we haven't voted on it yet, how has it been funded thus far? And why now, is it 6 and it's coming to the RIF? And I'm all for supporting, obviously, risk mitigation. It's just a little unclear to me how that's functioning, so.
Very quickly, thanks for the observations, Mike and Nicole, and I will be very quick, Ben. After this approval vote today, we're crossing a threshold by which the TCPB then gets to weigh in on all things RIF afterwards. Written into our intergovernmental agreements with the counties, prior to this approval, the counties do get to independently spend that funding on the RIF. What it does mean, and what I'm hearing from you, is that we actually do need to come back, Metro staff with county staff, to present on the risk mitigation program. And then you'll get to weigh in the future of the funding from the RIF. But today is a watermark moment where we're stepping across the Rubicon, as it were.
Okay, thank you, Lynn.
Just really quick, the landlord liaison work group did come and present to the TCPB last year, and we did had a presentation on the risk mitigation program. So maybe it's good timing to have them come back and provide an update and answer some of the questions that have been coming up about those programs and the roles.
Agreed. Sahan?
I am a yes, but I do want to make a couple of comments. One, absolutely double down and echo what Monta said. I would love to be able to see just a forecast estimate for the cost of the implementation plans to come. And then a piece of that is what Michael and Nicole are saying. I don't have any issue with spending $6 million from the RIF on this. My assumption is that we won't have big chunk expenses like that in some of the other implementation plans, so we'll be fine. But again, I don't mind spending that out of the RIF as long as we have it. If we have 6 goals and all of them are going to be $8 million, then we're going to run out of money and that's not enough. So I'm assuming that the rest are not going to be that same cost, but we'd love to be able to see that, and I would love to be able to fully get behind, like, no issues with $6 million coming from the RIF for this specific one, because we can see that we're fine with all of the other potential plans. Myself, I would love to be able to go to my county chair and ask for more money for higher wages for my staff than have money go from the county SHS dollars to support the risk mitigation fund. So I'm good with this and definitely okay moving forward as a yes.
Thank you, Sahan. And Steve, I see your comment about an update on Arla as well. Ebony?
Yes, I'm a thumbs up for this. I would like to see, because we're offering a 24-hour hotline, that there be 24-hour response, so maybe increasing the budget to account for possibly 2 staff to be constantly available for that, because what is the point of having an emergency line if there's not going to be an emergency response? And I know that landlords will think that is the expectation as well, especially with our current overwhelmed system. So that is something I would like you guys to strongly consider. And also for the risk mitigation, to ensure that there is some sort of practice in there where there's a third party that comes in to assess damages, as we have, as service providers, been hit with enormous bills because they feel that we're getting government funding, so they want to slice too. So to ensure that we're not being taken advantage of, that participants of our programs are not being taken advantage of, that the counties consider possibly bringing on just like for Washington County, where we have folks come in and doing inspections upon entry, maybe having a third party coming in and doing inspections upon exit.
Thank you, Ebony. So a couple follow-ups for returning around budget. It gets to your piece around capacity, Mike, and then this follow-up around kind of protection of the resource. Mercedes?
Thank you all. I am also a thumbs up. A couple of considerations. Well, one, just in defense of the regional fund, these things are also notoriously underspent, because just because somebody is poor and having experienced homelessness does not mean they destroy their unit. So I would rather us hold money that rolls over than the counties holding money that rolls over. A comment on the kind of structure. So for the Multnomah County pilot, there was a line deliverable about a regional assessment that was not included in the hotline. I think it should be there. It seems like it's part of the process. I don't think I'm asking for something weird. It probably was an intent there. But both pilots, like, I'm comfortable with the RIF funding pilots that are expected to expand regionally, not comfortable funding something that exists only in that one county. So having that line that says there's a regional assessment to happen helps us know at what point does this come off RIF or does this expand to the other 2 counties. Don't limit it to case managers, outreach workers, peer support specialists, housing specialists, all kinds of people are both helping people get into housing and then helping to retain the housing. I think you want both of those staff in there. So ask providers who's doing placement and who's doing retention and have those folks participate. I want to co-sign the comment Chair Harrington made earlier about timelines. So we've got winters, we've got springs, we've got fiscal years. It would be great to have a consistent way in which we're talking about timelines, maybe months and years instead, or maybe some kind of calendar. And then my last comment is actually a question, which is for that $8 million, given that we have multiple timelines within this, and a single budget, and then each thing has its own budget, but some of them are also a range of budgets, are we approving $8 million as a total that can kind of move across the 5 strategies? Or are we approving exactly those line items for then the timeline at which that was approved?
Yeah, Liam, do you want to take that?
Yeah, that's a short answer. This is a preliminary estimate of what these dollars are going to be and what they'll invest in. We fully expect the counties and Metro staff to return once we shore up those numbers. And for now, those numbers could shift in either direction, but you'll see them get narrowed down over time as implementation is upon us.
But I think you're also asking, like, is each budget kind of its own unique thing, or is it one big bucket of money that can just weave back and forth?
Yeah, I mean, are we like approving $8 million however it goes across these 5 strategies? If something is going to cost more than it initially said, will that come back for additional approval?
Yes.
Or,
Yeah.
Yeah, that,
Right, so it's program by, or recommendation by recommendation, right, with a cumulative cost. Chair Vega Peterson?
one quick caveat to give, two of the strategies support one consultant, so that might look a little different for the comms and education strategy, one just because it's also going to be supporting some of the work and strategy too.
We'll capture that for the record. Chair?
Okay. Okay, there.
It's hard to see, yeah.
I'm a thumbs up. I do have a question about the benefits project or property management, Mercedes. Maybe you and I can talk about that because, like, does this differ than how, like, CDCs, for instance, who operate as property management, or maybe that's the model you have in mind? But I'm just curious about, like, what you're thinking there, so we could talk about that offline. I'm still supporting it. And I think the other thing is for the risk mitigation fund, like, I'm still relatively new to this. I do want to have maybe a better understanding, because for me, like when we're looking at Housing Multnomah now and we're looking at some of these programs, like you absolutely have to have a risk mitigation fund for landlords in order to get them to incent them to like take part in the program. So that's a huge thing. And across the region, that's going to be a huge, $6 million makes sense for that. So I just wanted to make sure I'm understanding that, because it's such a crucial thing to make sure that these programs are going to be successful, as well as some of the other strategies that we've seen in terms of like the case management and the hotlines and all that. I love all those ideas. And then I just want to be clear, like when we talk about the RIF, we're talking about like 5% of the funding, right? That's a huge amount of money. So I'm saying like, we got to get the pedal to the metal and get these dollars and programs up and running and the dollars out the door. So I'm so glad we're doing this work tonight. Okay, thank you.
Thank you, Chair. Chair?
Oh, looks like my mic is still hot. Sorry if I was making noise earlier. This is our TCPB notebook to date.
Oh.
We adopted our goals and recommendations in May of last year. So that was in year 2 of the SHS program. We are about, in March of year 3, about to approve our first goal implementation plan. We're in year 3. This committee really needs staff leadership to provide the as you recall moments. One reason why I put this notebook together was, since that hasn't been happening, I've been doing it for myself. In our information from last month, you told us we had 37 to 49 million in RIF now. It changed from what we had in the document, since it didn't include Multnomah County at first. So we have a boatload of money to put into action, and we have an implementation plan here to put into action. 40 million over the first 3 years. We're in year 3. We have a great recommendation here let's do it. Thumbs up.
Thumbs up, I love it. Well, at 6 o'clock, I'm going to ask now that we have a motion, a second, any discussion, although I'm discouraging it, and then vote.
Motion to approve the landlord recruitment implementation plan?
Second.
Who snuck in there? Was that
Everybody
Mercedes? So we're going to, everybody has a
All in
motion,
favor?
seconded by Mercedes.
All in favor?
Aye.
Thumbs up from the screen?
Is there any opposition?
Any
Not seeing any. Nice work at 6:01. It was so close, but good job, everybody, and good job, counties, Metro. That was a quick turnaround from, I was a little nervous about when I missed a meeting, and then I was like, what happened? And here we are. So great job, great meeting, great discussion. Pat yourselves on the back. Meeting adjourned.